Today topic of discussion factors affecting wound healing. Local and systemic factor affecting wound healing. So there are two factors. One is local factor, another one is systemic factor. Local factors examples infection, location, mechanical factors, size and types, blood supply, size and type of infection. Okay, then blood supply, radiation. Systemic factors example age, nutritional status, diabetes, glucocorticoid, then hematological abnormalities. So local factors, first one is infection. Infection which is responsible in delay of wound healing. Whenever there is persistent infection, we all know that persistent infection result in persistent inflammation, and that result in delayed wound healing. Apart from persistent inflammation, there is the injury itself persistent. So that's the reason why there is delay in wound healing, particularly whenever there is infection. So infection then injury, because of that reason only it will take more period. Necrotic tissue and foreign bodies in the wound both prolong the inflammatory response and increase risk of inflammation that delay wound healing. Second important things is location. The location of wound is particularly over the joint where the mobility cannot be restricted. If there is more and more mobility, delay wound healing is more. So because of more and more mobility, it will take long period of healing. So next factor, mechanical factor. Any movement over the wound surface short of result in entering normal the repair process, the vessels might get compressed. Because of mobility movement, the blood vessels compressed, the wound edges get separated. So wound edges get separated and that result delayed in wound healing. So because of mobility, the repair, that vessels might get compressed, the wound edges get separated, that result delayed in wound healing. Then types of wound healing. If that small surgical wound means it heal faster by using primary intention. In the case of severe trauma, blunt trauma, which is the large wound, so it healed by secondary intention. Next factor, blood supply. Wound which have adequate blood supply heal faster. Adequate blood supply means heal faster. Wound which have poor blood supply means it will take healing, it will take long period of time. So poor supply means it will take long period of time. Then because of atherosclerosis, immune suppressive therapy is increasingly being used in clinical practice conditions such as organ transplant and inflammatory bowel disease. Then less blood supply, example that hypoxia, blue color changes. Adaptive cellular response to hypoxia are mediated by HIF2 factor, which upregulated that expression of many genes that enhance healing in low oxygen condition. Last factor, radiation. Ionizing radiation decrease whole repair process. So ionizing radiation decrease whole repair process. Moving on, systemic factor. First one is age. Age is one of the most important systemic factor where wound healing is very rapid in young individual and compared to that elder individuals. Next one is nutritional status play an important factor which can result in delayed wound healing. For example, if the patient is suffering from nutritional or vitamin C deficiency, vitamin C is essential for collagen synthesis. When you have deficiency of vitamin C, might result in inhibiting collagen synthesis that can that wound healing. That patient with malnutrition also, then lots of protein deficiency that can result in delaying wound healing. Then diabetic mellitus condition is one of the most important systemic factor which can result in delayed wound healing. There are so many cases in that can result impaired wound healing. One of the most important cause microangiopathy. So diabetic mellitus has circulation slowed down. Blood moves more slowly, which make it more difficult for the body to deliver nutrient to wound. As a result, the injury heals slowly or may not heal at all. Next, glucocorticoid steroids. Glucocorticoids, steroids most important inhibit TGF beta. The TGF beta is important for healing by connective tissue deposition. They are the one which stimulate fibroblast to synthesis collagen. So there is decreased fibroblast is wound healing might not be proper if there is an glucocorticoid supplementation in these cases. Last one is hematological abnormalities. One of the systemic factor which result in impaired wound healing, particularly quantitative deficiency of neutrophil. A neutrophil important component which appear during the initial stage of wound healing. Whenever the defect of neutrophil can result delay wound healing. So these are the important factors affecting wound healing. So in this video we discussed factors affecting wound healing. Two factors, local and systemic. Local factor infection, then location, then mechanical factors, blood supply, example hypoxia and radiation. Systemic factor, age, nutritional status, then diabetic mellitus condition, then steroids and hematological abnormalities, mainly neutrophil we discussed. Thanks for watching.